Assalamualaikum warahmatullahi wabarakatuh. We're from Group 13 and today my group and me are going to talk about the factors associated with geographic tongue and also fissured tongue. So our group from Group 13, we have NURUL, NAJWA, QAISARA, FARAH, NABILA, FARIS, DANISH and me, HANY, SURAYA. So me, HANY, SURAYA, I'm going to firstly talk about the geographic tongue, which is specifically the case history. So, what exactly is geographic tongue? Now, geographic tongue has a definition of a benign inflammatory condition, and it is also known as a benign migratory glossitis. Not only that, it also has a synonym of the erythema migrans, annulus migrainus, wandering rush of the tongue. Now, the geographic tongue, it usually comes together with a fissured tongue, and it can also be associated with a vitamin B deficiency. Now, next, I'm going to talk about the case report and also history of the patient. So, our group, we include a case report, a case study, and from there, we can find that a patient who is a 38 years old female and had no history of allergies at all, and she lived from Casvin, Ireland. So, based on this report, we found that the patient of her symptom is that she had a mild to moderate continuous pain. She had a burning sensation, especially when she is eating an acidic food. And the sensation only can be relieved by taking medications. And not only that, she also had a history of chewing discomfort. And she said that she has no allergy history, like I said earlier. And she also has no history of psoriasis and family history. Now, what is this important is that because the psoriasis can be involved to the patient who had fissured tongue. And like I said earlier, the geographic tongue can be associated or comes together with the fissured tongue. So, based on our research is that and our readings, what patients usually experience when they are having the geographic tongue is that they will have lesions, and the lesions will usually appear in one area only, and it will even heal in a few days or weeks. But however, the lesions will reappear again at a different site. Okay, next I'm going to talk about the signs and symptoms that usually experienced for the patients that suffer from geographic tongue. Now, usually the patient will experience, most patients will experience no symptoms, but for the patients that experience symptoms, it is usually associated with soreness or irritation that are associated with acidic food. Next, I'm going to talk about the risk factors of the geographic tongue. Now, basically, the geographic tongue may be related with a family history or with the age, which usually happens to the middle-aged people, and also psoriasis. Now, what exactly is psoriasis? Now, psoriasis is a skin disorder in which that the skin able to multiply 10 times faster than normal. Now, moving on, we're going to talk about the fissured tongue next. And I'm going to talk about the case history first for the fissured tongue. Now, since we're taking from the content from the same case study like earlier, so the case report that we have of the patient are similar like the earlier one that I talked from the geographic tongue of history of the patient. So basically the patient will experience a mild to moderate continuous pain, a burning sensation, and the sensation will usually get relieved by the medications, and she will also has a chilling discomfort, and she has no history of allergies, psoriasis, or family history of having or experiencing the allergy and psoriasis. So what exactly patients usually experience for patient with the fissured tongue? Now, they will usually experience the presence of numerous grooves and fissures. Now, where is this groove and fissures located? It is usually located at the dorsal of the tongue. Moving on, I'm going to talk about the signs and symptoms usually experienced to the fissured tongue patients. So usually the patient will experience no symptoms, means that they will usually asymptomatic. But for the patients that usually comes with symptoms, usually these are because of improper brushing technique. Well, because technically the fissured tongue usually have growth and fissures, right? Now this might be quite tough for them if they have an improper brushing technique because they need to clean all those debris, and if they has no proper brushing technique, this will cause some of the food debris to be actually stuck between the fissures and the groove, and hence which would lead to symptoms that they will experience later. Okay, so lastly, I'm gonna talk about the risk factors of the fissured tongue. So basically, these risk factor of people that could get the fissured tongue are usually individuals with a Marcus-Rosenthal syndrome. So what is exactly this syndrome? So Marcus-Rosenthal syndrome, it is a rare neurological disorder, and it has a characteristic of facial paralysis, swelling of the face and the lips, cheilitis, and also development of folds and furrows in the tongue. That's all from me. I'm gonna pass to the next presenter. Thank you.
Assalamualaikum, I'm NAJWA. I'll be explaining the examination of geographic tongue and fissured tongue. For the clinical examination, usually tongue examination are already sufficient. However, according to our case study, the scalp, hair, palms, nails, sole, and eye were examined just to differentiate it from other similar oral lesions such as psoriasis. The clinical feature for geographic tongue are a group of smooth reddish pink atrophic or depapillated patches on the dorsal or lateral borders of the tongue surrounded by whitish slough. You can see some of the patches lined by the green pen on the picture on your left. This picture is taken from our case study. The patient suffered from geographic tongue superimposed by fissured tongue. But for better reference, you can see the picture on your right. The patches may change drastically in size and shape, disappear and reappear again in a duration of time. Usually, it is also asymptomatic, or patient may sense a burning sensation due to hot or spicy food. For histological feature of geographic tongue, it is characterized by numerous polymorphonuclear leukocytes that migrate through the epithelium. The stratus spinosum may be thickened and edematous. In the smooth red areas, the papillae of the connective tissue may reach high up close to the surface. Radiograph is usually not needed because of its distinct feature. Next, let's see the examination of fissured tongue. The clinical examination is almost the same as geographic tongue, which is tongue examination is already sufficient. For the clinical feature, it features a malformation characterized by furrow or groove on the dorsum of the tongue. It is usually asymptomatic or burning sensation due to hot or spicy food. You can see it clearly on both pictures. For the histological feature, it will have a hyperplastic surface epithelium with elongated rete ridges. Papillae are often separated by deep groove. Mixed inflammatory cells infiltrate within the lamina propria. Radiographs are usually not needed because of its distinct feature.
Assalamualaikum warahmatullahi wabarakatuh. My name is QAISARA binti IBRAHIM, and now I will be delivering the investigation part of this presentation. Without further ado, let me begin with the investigation for geographic tongue. So we will now begin with the definition of geographic tongue. Geographic tongue is a recurrent benign condition of the lingual surface. It is also referred to as benign migratory glossitis. The condition is usually asymptomatic with good prognosis. The name benign migratory glossitis for benign means harmless overall. Migratory refers to how the lesions in geographic tongue often heal in one area and then move to a different part of the tongue, while glossitis, which is inflammation of the tongue, indicates that this condition is an inflammatory condition. The appearance of geographic tongue, you can see that there is migrating areas of smooth reddish discoloration of mucosal surface of the tongue. These patches are missing papillae, and they are often referred to as red islands. This gives the tongue a map-like appearance, hence its name, geographic tongue. Now we will move on to the etiology of geographic tongue. As of at the moment, there is still no known etiology for the condition. However, studies suggest a few factors that may be related to geographic tongue, including hereditary factors, fissured tongue, and also psoriasis. Other conditions that may be related to geographic tongue also include allergies, emotional stress, juvenile diabetes, Raynaud's syndrome, and hormonal disturbances. In regards of emotional stress, it is seen that there is a higher prevalence of geographic tongue in those who have higher risk of emotional stress, while for hormonal disturbances, females who use oral contraceptive drugs are more commonly affected by the disease. Now we will delve further into factors associated with geographic tongue. The first is hereditary factors. The reason why this is associated with geographic tongue is because the condition tends to run in the family. In fact, it is more prevalent in first-degree relatives, which is at 14.4%, than in control groups, where the participants are not at all related to each other, at 4%. This statistic is retrieved from Redmond et al. Study. The next condition that is related to geographic tongue is fissured tongue. Fissured tongue is a condition where there are deep grooves on the surface of the tongue. This condition has a strong genetic link, which further supports the idea that hereditary factors contribute to geographic tongue, and the condition fissured tongue tends to occur together with geographic tongue. Following that is psoriasis. Psoriasis is a chronic inflammatory skin disease. It has similarities with geographic tongue in terms of clinical, histopathological, and immunohistochemical features. There is also a strong association with human leukocyte antigens, HLA-CW6, and weak association with HLA-B13 in both conditions. However, it is to be noted that this association is considered controversial because there is lacking in terms of strong evidence, as well as the fact that geographic tongue can occur in healthy people. Now we will be talking about the lab tests or examinations that can be done to determine geographic tongue. In general, geographic tongue is usually diagnosed by its characteristic history and clinical features. Histology is rarely necessary. However, when it comes to atypical cases, biopsy may be taken. Further evaluations may be required if any of the following associations with geographic tongue is expected: psoriasis, HIV or human immunodeficiency virus, lichen planus, diabetes mellitus, lupus erythematosus, Down syndrome, and also Arscock syndrome. Next, we will move on to the investigation for fissured tongue. Now we will move on to the definition of fissured tongue. Fissured tongue is a benign condition and is characterized by furrows or grooves in the dorsum of the tongue. Those grooves that can be seen in fissured tongue can either be shallow or deep. The condition itself is generally painless. However, when food debris accumulates in the fissures, it may cause irritation and lead to pain. The condition tends to become more severe and prominent with age, but the signs may be present during childhood. When it comes to the prevalence of the condition, fissured tongue occurs in approximately 5% of Americans, but the number varies worldwide. Typically, Men are slightly more likely to develop fissured tongue compared to women. Now we will move on to the etiology of fissured tongue. So far, there is still no known etiology for the condition. However, it is important to note that this condition is not considered a disease for many people. Instead, they believe that this condition, fissured tongue, is actually an anatomical variation of a normal tongue. Factors associated with fissured tongue include Down syndrome, Melkerson-Rosenthal syndrome, malnutrition, vitamin deficiency, as seen in the case report that we have included, psoriasis, as well as geographic tongue. Now we will move on to the lab tests or examinations that can be done to determine fissured tongue. Actually, there are no lab tests that can be done to determine, as it is usually observed as an accidental finding on routine dental checkup. Fissured tongue is determined through the clinical appearance of tongue, and biopsy is normally not indicated. Regarding the prognosis for fissured tongue, considering the fact that this condition is benign and generally asymptomatic, it has a good prognosis and generally no treatment is required. However, if a patient fails to properly care for their oral health, bacteria and plaque may collect in the fissures, causing bad breath and also tooth decay.
Assalamualaikum, my name is Faris. Next, I will explain about the diagnosis for the geographic tongue disease. As I've been mentioned before, the diagnosis of geographic tongue is made upon a clinical evaluation, detailed patient history, and the characteristic appearance of the tongue itself. This disease often comes with fissured tongue, so it is important to differentiate the clinical features between the both disease. And one of the main characteristics of geographic tongue includes the irregularly shaped, red, map-like, smooth and swollen patches surrounded by the white lines, as we can see from the picture. And the microscopic features or biopsy of affected tissue is not necessary. This is because of its distinct appearance of the tongue and its prominence feature make it more easier to be diagnosed. Next, for the diagnosis of the fissured tongue, it is actually quite similar compared to the geographic tongue, in which the condition is usually observed as an incidental finding on a routine dental examination, and the diagnosis made by the characteristic clinical appearance of the tongue. Patient history is also important in helping the diagnosis of the disease. This is because the features may appear during the childhood, and with age, the features can cause deepening and become more pronounced. Regular checkup to the dentist may easily help in diagnosing this disease. During the physical examination, what usually the dentist or physician do is, firstly, they will use the lighted instrument to check the tongue and mouth. Next, they will ask the patient to move their tongue around in various positions, and they will gently touch or palpate the patient's tongue to check for its tenderness or unusual changes in the tongue's texture or consistency. And lastly, they will check for signs of infection such as fever or swollen lymph nodes in the neck area. Next, we'll go to the other similar condition related to the tongue disease. And the first one would be the oral candidiasis. The oral candidiasis is an common opportunistic infections of the oral cavity, and it is caused by overgrowth of Candida species, commonly the Candida albicans. The incidence varies depending on age and certain predisposing factors. The three main clinical appearances of candidiasis are generally recognized as pseudomembranous, erythematous, and hyperplastic. The risk factors include the impaired salivary gland function, drugs, dentures, and high carbohydrate diet. Next, we'll go to the second other similar condition, and it is the oral leukoplakia. It is actually a potentially malignant disorder affecting the oral mucosa. It is characterized by the white patch or plaque that develops in the oral cavity. It is strongly associated with smoking. Most of the white lesions are benign, and the diagnosis is usually evident from the clinical presentation and histopathology. The leukoplakia characterized by an increased risk of malignant transformation. The histopathology of leukoplakia can disclose hyperkeratosis with dysplasia, carcinoma, or hyperkeratosis or parakeratosis with dysplasia.
Assalamualaikum warahmatullahi wabarakatuh. My name is FARAH NABILA and I will present about treatment plans for both geographic tongue and also fissured tongue. For geographic tongue, usually there's no treatment is required. But when there's a discomfort and burning sensation during eating, it can be avoided by avoid eating hot and spicy food, acidic food, and also dried salty nuts. Next, for the symptomatic treatments, it may include topical anesthetic agents, antihistamine and anesthetic mouthwash, and also topical steroid. Usually, patients with geographic tongue are associated with iron deficiency. So, oral iron therapy will be one of the treatment that can be done. For fissured tongue, basically there is no necessary treatment. But for patients with fissured tongue, they need to practice proper oral hygiene. First, by cleaning their tongue using tongue scraper or soft brush after meals. They also can use mouthwash, which contains 0.2% solution of chlorhexidine gluconate twice daily, and they need to have a regular visit to the dentist. In extreme cases, Candida albicans may infect a very deep groove. So anyone who develop this complication, they will require a treatment with a topical antifungal medication.